Welcome, everybody. Tonight, it is my pleasure to introduce Dr. Barb Williams. This is Beyond Telehealth, and I'm Dr. Lisa Finkelstein. In our past interviews, we have been talking about how wonderful and terrific and innovative telemedicine is. Tonight, we're going to switch gears a little bit, and we're going to talk about the challenges of telemedicine and the struggles that some practices have and patients have with utilizing telemedicine. So this is sort of the other side of the story. So the first thing we're going to ask is Dr. Williams to introduce herself, tell us what specialty you practice, where you practice, what EHR you use, and what telemedicine platform you may or may not use.
Okay. Hi there, Lisa, and thank you for inviting me into your program this evening. As Lisa said, my name is Barbara Williams Page, and like you, Lisa, I am a graduate of the Philadelphia College of Osteopathic Medicine, Philadelphia campus. So, we have to specify the campus now.
Right.
So, like you, I'm part of the Philadelphia campus. And that's also where I completed my family medicine residency, believe it or not, 25 years ago.
Yeah, we won't talk about that.
And since then, I have been employed by PCOM. I'm a medical director at one of their healthcare centers. And in addition to caring for many patients in the North Philadelphia community, we also provide hands-on training for our fourth year medical students. Now, as far as
what else do you have next to your DO degree?
My MBA.
Yes.
That I obtained that, two years ago. PCOM is doing a collaboration with St. Joseph for an executive MBA program in healthcare administration.
Awesome.
So I did go through that program as well. So let's see, as far as our EHR system, we are using NextGen. So I know your platform tonight is Beyond Telehealth. And as far as a telehealth platform, we, like many other outpatient facilities, when this pandemic hit back in March, we were not prepared. And we were not, currently using a telehealth platform. We were not doing telehealth.
Right.
So we didn't have a platform, but we were forced into telehealth like many other healthcare providers.
Right. Okay. So the question then is what have you been using with your patients for telemedicine? Tell us how you have sort of figured it out.
Okay. So with the use of our electronic health system, and this is a system that we implemented this 10 years ago. And thank goodness we did implement this 10 years ago, because if we did not have this electronic health system, we would have been in trouble.
Right. We're not using the pencil anymore.
Exactly. So as long as we have our computer, we're able to access our electronic health system, that and our cell phone. We were able to still communicate with our patients during the pandemic.
Okay, so let's pivot for a second. I want to go back in time a little bit. One of the things that you have been exposed to a few years ago was using a doctor on demand type platform. So you've had experience with telemedicine. Tell us about that, and then tell us how that differs from what we're talking about tonight, telemedicine.
Sure. So what I did with that platform, like you said, that was an on-demand platform. So with that on-demand platform, and when you say telehealth, that's what many people think of. They think of this on-demand platform where you're not able to reach your primary care provider, or maybe you don't have a primary care provider. And this may be, late at night, weekend, holiday, you're away on vacation, you develop urinary tract symptoms, you develop a sinus infection, you develop poison ivy, and you need to see someone quick, and you don't want to go to an emergency room. It's not an emergency, nor do you want to go to an urgent care center. So the on-demand platforms, the patients do utilize them more for that, not for continuity of care. So what we tried to provide during the pandemic is patient continuity. So we were still trying to maintain that continuity with our diabetic patients, with our hypertensive patients, with our asthmatics, doing medication reconciliation. The on-demand platforms, they're not there to take the place of the primary care provider. So they're not reconciling medication, nor are they initiating medications for chronic conditions.
Right.
So that is still left up to us, the primary care providers. So that is the difference. Also with the on-demand platforms, they already, they've been around for years, and so they already have their own platforms. They have their own system in place. So they have their video platforms in place.
Right. So that leads me to the next point, which is one of the beauties of telemedicine in my book, starting when I was practicing telemedicine, was to be able to put eyes on a patient. So the telephone, which is now a type of telemedicine that we used to talk about as the telephone, we now are moving towards these video platforms. But during the pandemic, you have not been able to actually see your patients, but you know your patients. So you were saying that you know who they are, but don't you think that it might have been a little bit better for these chronic care patients for you to actually look at them?
So, of course, it definitely would have been better to see them, especially if they were exhibiting any symptoms that I needed to visualize, rather than them trying to explain it to me over the phone. Now, like I said, when this pandemic started back in March, we were not previously using telemedicine, so we did not have a platform already or protocol already in place for telemedicine. Now, some of the providers within, we have a large department, some of the providers in our department, they took it upon themselves to use an app.
Yeah, figure it out.
Right. Yeah, they figured it out. It's various apps. Not all of us use the app. Not all of us are that tech savvy. So we all did not take advantage of that app. But we have been made aware that there are some apps out there. But hopefully as a department, we will develop a telemedicine protocol and maybe invest in a telemedicine platform so that all of our offices, all of our providers are utilizing the same platform.
Well, and that's where everyone is headed. It's just taking time. The other component, though, is also your patients. So you're living, or your practice is in an urban population, maybe underserved, maybe not as healthy. How did they deal with telemedicine? And if you had to look into the future, how would you see it happening better?
So this pandemic was one that there's a notice here. This pandemic was one that everyone understood this pandemic. So the patients, they were not upset that they were not able to get into the office. Everyone was very understanding about this pandemic. And I think some of the offices that managed to stay open, the patients weren't coming in.
Yeah.
They were the offices that tried to stay open, they were dealing with a lot of no-shows because the patients did not want to come in to the office. And when we slowly reopened in the summer, many of the patients did not want to come in, even though we, reopened our doors. So the patients were very appreciative that we were still able to contact them and continue their care in the form that we did continue their care. Even though I did not do video calls with my patients, they were still appreciative that I was able to still connect with them.
Do you think that some suffered because they were not able to get in, or they didn't seek care, or, were there any consequences that happened to your patients because of the pandemic?
If there were, Lisa, I'm not aware
Okay.
of any consequences that occurred. We managed to provide, phone visits for everyone who needed them.
Good. Okay.
So, and even now that we're fully open and patients are coming into the office, no one has reported to me any negative impact.
Right.
That was had.
We hear that people aren't getting their screenings done. The kids are not getting vaccinated. People are sort of falling through the cracks because they're not able to get in, and doctors are just trying to do the best they can.
So early in the pandemic, that was a concern. We did have some newborns. We did try to, our one office, and you're familiar with the area of Philadelphia. So when I say City Avenue, you know where City Avenue is. We have one office on City Avenue that we opened first, and all the providers rotated through that particular office. That's not my home office, but I would offer an appointment to my patients to come to that office so that we can, immunize the kids. Believe it or not, the patients didn't want to come.
I know. That's definitely that. Yeah, that was. And we were telling them we were sending the message: don't come. Don't come and sit in a waiting room full of contagious people. It's still happening, and that's why telemedicine is here to stay. And that's the next thing. So, if you had a telemedicine wish, what would it be moving forward in the future?
Well, you just said that it's here to stay. And like I said, prior to this pandemic, we were not doing telemedicine, even though we were not doing telemedicine. But the president of PCOM, Jay Feldstein, he has actually touched on telemedicine since day one of coming to PCOM. So he's been mentioning telemedicine, and now here it is.
Here it is.
So we're doing it.
Yeah.
But like you said, it is here. It is here to stay. And for years, telemedicine has been changing, the whole landscape of outpatient medicine. And it's going to be a permanent fixture. So my wish list is to now implement that protocol for telemedicine that is the same for, across our entire department, instead of one office using one app and another office using a different app. I would like to see us implement a telehealth platform that we're all using. But also one thing that I think I mentioned it in the beginning, that our site, we also provide hands-on training and education for our fourth-year medical students. So providing hands-on and providing education for them, we have to find a way to incorporate them into this whole telemedicine protocol.
Well, I have a wish. I wish that you will be the telemedicine champion moving forward and get all these ideas to happen in your department, because it will be woven into the fabric of your everyday. It is being woven into physicians' everyday, and patients are now going to expect care that comes to them. It's a whole different paradigm that is happening. And patients are you're going to ask your patients to buy a blood pressure cuff and to get on the scale and to take their temperature and do their vitals at home rather than coming into the clinic to have that done.
And Lisa, during this pandemic, there were some patients, and I was surprised when it happened. There were a few patients, they started the visit themselves with, I have my numbers. And I said, what numbers? They had their blood pressure ready, their blood pressure reading.
Oh, awesome.
They had their blood sugar reading. They had their weight ready to give me that. I said, well, thank you.
I don't think we give patients enough credit.
Yes, but that is something that, moving forward with this new landscape, this is the minimum that every patient should have in their home: a glucometer, a blood pressure monitor, a scale. And those are the three vitals. You said pulse ox?
Yeah, it's $10.
Mm-hmm. Yes. Yeah. Which will also give us heart rate.
And heart rate. And right. All kinds of neat things are happening. Well, Barb, let's see. We're 16 minutes. It's
wow.
5. But I didn't want to cut you off because I think this is so important to hear the challenges that physicians are facing out in the real world. And I wish you lots of luck. And thank you for doing this interview. I really appreciate it.
Thank you, Lisa, for having this. Thank you.
Yeah. All right. We're going to sign off.
Okay. Thank you. Bye-bye.
Bye.